This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. You didn't know you were the one and only.
No, you know what, John? I think you're the one and only. Right, according to our patients, you're the one and only. Isn't that the truth? I swear, I said, I hope John gets some rest while he's in the chair because they're all going after you. I know that, and rightfully so, John. We all appreciate you.
I saw your look when I said the one and only, and you went, okay.
Yeah.
Okay.
I don't believe that, but...
Oh, anyway, 855-839-1210 is the number here in the studio. If you have a question for Dr. Molly or you have a medical challenge you want to run by her, 855-839-1210 is the number. And again, it's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Always good to have you with us. And we should start by letting people know. Yeah, here we go. This is the part of the show where we say this every week, and yet every Monday or Tuesday you get calls. And, well, what exactly do you do?
It's difficult, John. It really is. It's because it's sort of a unique primary care facility in that we are a group of like-minded healthcare providers who believe that we'd like to improve your quality of life by using the least amount of pharmaceutical that you need to treat your condition, make sure you're medically safe, and move forward with your quality of life. Simple thought, not so simple to do. And here's the thing. We know that there are natural substances that can augment your pharmaceuticals and in some cases even actually replace them, but they have to be delivered in a way that the therapeutic value gets to the right dosing for each individual patient and doesn't, first do no harm, as they like to say in medicine. And again, my medical providers do look at this and we are able to help people. So yes, there are natural substances like the kind you can get in the health food store. That's what we use.
And these substances are not only vitamin C, but many other things.
Minerals, amino acids, herbals, homeopathics. There are many things that can augment a patient's pharmaceutical regimen and help them possibly get off some of them, especially if they're on a multitude of drugs. And maybe the side effects that they are experiencing have nothing to do with the condition. And that's unique in and of itself because the doc has to go through this and we talk about it and say, okay, how do we help this patient and not put them in harm's way?
And you deliver this through hydration.
There it is. And why hydration? Because, again, we can look at a specific nutraceutical in an actual therapeutic range to help that patient. And, I think there's a real misnomer about natural substances, John. It's like people say, oh, well, it's like plant-based, it won't work. No, it's because they have certain constituents that are in these plant-based or in these natural substances that actually have therapeutic value. And that's what medical hydration can do for you.
Other than vitamin C, what's the top?
I would say the B vitamins, the extracts from bees. I would also say natural occurring amino acids and peptides that are out there. So that there are many. Again, it's not one thing. It's really what is best for the patient and in what dosing in terms of the natural substances as well. And again, I'm not going to tell anybody out there, throw away your statins, throw away your new medications. But I am going to say, listen, if you're having some side effects, I want you to think about when did these side effects occur? Did they occur after you were put on a new medication maybe? John, you're a prime example of that one. And how about your comorbidities? Here's the beauty of medical hydration facilities. And again, I want to say that separates us from spas and that kind of thing. Here it is. What is the underlying cause of your challenges? That's what we need to find out. Is the problems that you're having with your quality of life based on the remedy that you got conventionally, or is it the condition itself?
Let's dispel one myth, and that is you can get whatever Dr. Molly has in the health food store.
Well, you can.
You can, but it's not the same.
You can't get it in the same manner, nor can you get it probably in a dose that's appropriate to reach the therapeutic level to effectuate the change. And therein lies the rub.
So in the health food store, you would get a drop.
Well, and compared to an ocean, right.
That's right.
But even that, again, sometimes a drop can do it. But you have to have some guidance. That's the other thing I think that really separates us from a lot of the spas. Look, we're not a Chinese menu. You don't come in and say, I want one from column A, one from column B, and by the way, we want the dessert too. But you know what? No, it doesn't work like that. We really need to know what's going on for you in a given period of time. How can what we do help you? And what can we do that can help you maintain your quality of life?
What are some of the questions that you usually get in an initial consultation?
Well, why can't I go? My hair salon is now doing vitamin C. Next door, okay? Well, you can, but do you know the extract of the vitamin C? You can go in and ask, what's your dosing? Are you just getting a standardized cocktail like they give for the drunk tanks? What are you doing with this, and who's delivering and when? I have to tell you, I saw a terrible, terrible article, and my nurse administrator, who is brilliant, Donna, who just came to us, doing a whole lot of surveys for the state. She's retired, and she's helping with our clinical recipe, so to speak. But very intelligent thing. But we just started talking. We saw something in another state where they delivered the wrong type of product to a patient, and the patient expired right there on the chair. Now, let me tell you, the minute you put something into somebody's veins, the minute you put anything into the body, you better be on top of it. And one thing you're going to say, I have more nurses now than Carter has liver pills.
That's right.
That our clinic is staffed, and my nurses are good, and my techs are good because they listen to the chain of command.
How many treatments should people expect, at least to get started?
Well, I think you need at least 5 to 10 treatments, and that's the absolute bottom line minimum, because you can't effectuate the change in the quality. And again, it's also going to depend. You know, your quality of life and mine are different than, let's say, George's or Nicole's. So you really got to think, okay, what is it that I want to accomplish, and how can Dr. Molly and the staff help me accomplish this?
You've obviously helped a lot of people, and we'll talk later on in the show about patients. But what's the biggest problem you see today?
Today, autoimmune. Autoimmune.
And we're going to talk about
whether it's a cancer-related autoimmune, because we believe cancer is an autoimmune problem when your cells go haywire. Autoimmune pain is another one, and just all around quality of life issues that are really hurting people, the nerve pain and diabetes, all of these things that, of course, people talk about, well, it's my genetics. Well, I'm going to get into that a little bit later. Yeah. But yes, autoimmune has certainly rose to the forefront. It wasn't that way 20 years ago. It was really more cardiac, and and cancer, of course, was around, but it seems to be more prevalent today. And I think overall, we're really looking at part of the reasons why, and we'll go into that a little later.
Let me talk to you about side effects. Is there? I mean, we know the prescription drugs have zillions.
Sure.
But with natural products, are there side effects?
Sure. I have to look and make sure that the patient's not allergic to them, right? And if one of the constituents, like, you know, if you have an allergy to bee pollen, I can't put bee pollen in the bag, right? You know what I mean? So there are things like that. But also, you can have side effects with nutrition, but here's the deal. You can have an allergic reaction to some certain nutritions. But I got to tell you, in 26 years, any side effects we've ever had is just a little lowering of the blood sugar because someone didn't eat before they come in for their IV. And of course, that's why I have crackers and things like things to munch on while you're there. But I have to tell you, that's about the only side effect we've seen because we're very careful with our extracts to begin with.
And that is leading us into our first break of the morning. Our show is Health Watch every Sunday, the live version, that is, 8 until 9 right here on Talk Radio 1210 WPHT. 855-839-1210 is the number, 855-839-1210. I always tell you at this point, call early. Then we have plenty of time to talk to you. And again, last week we had 4 calls at the end of the show. We got them all in, but it's rush. We don't want to rush. So if you have a medical challenge or a question for Dr. Molly, 855-839-1210 is the number, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. We both return with more of today's Health Watch after these words. We are back here on Health Watch, and as always, when we're on the radio, operators are standing by at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. When you call, probably the best thing you can do, if you have some questions, feel free to ask them that. But really schedule the initial consultation with Dr. Molly. It is complimentary, doesn't cost you anything, and that's where you really find out whether she can help you or not. 856-489-0505 is the number, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to go to the phones. Tony in Capitol Hill. Good morning, Tony.
Hi, Tony.
18 September 16 at 4 p.m. Passaic County.
Thanks for the call, Tony. Thank you very
Tony.
much. Thank you. 855-839-1210 is the number here, 855-839-1210. You've been having a lot of consultations, a lot of patients with autoimmune, and there's a little twist to this.
Oh, there is. In the last, I would tell you, John, that these chronic conditions have really exploded probably in the last 15 years. I mean, we really have seen more and more of these. And some of the autoimmune conditions that we see are the ones we know, celiac, and IBS, inflammatory bowel, lupus, MS, as we've had great success with, rheumatoid arthritis. How about psoriasis, But I found it very frustrating from my perspective because most of my patients who come in with this, and the doc actually feels this way as well, because she herself has an autoimmune disorder, MS, and she's doing very well. But she hates, and I hate to hear something that when you receive a diagnosis like that, and particularly when you're relatively young, in your 50s, 60s, and 70s, we believe that's young, you really can't enjoy your quality of life, and you're told you're going to have this forever. Well, we look at the symptoms, okay? We start to look at the symptoms, the fatigue, the weight gain, weight loss, rashes, anxiety, mysterious swelling. We start looking at the pain. How about temperature deregulation? Would you believe that? People are hot, people are cold, and I've seen a lot. Digestive problems, food sensitivities that are more than ever, and always in that group are nutritional deficiencies. So if you have any on all of these and you've been suffering with this and they still haven't told you, oh, you have MS, oh, you have ALS. I have a patient right now who finally had the muscle biopsy, and it says the muscle biopsy actually is very inconclusive because it says she has inflammation in the muscle tissue. Not ALS, not Lou Gehrig's, not Huntington's, none of the above.
So what does she have?
Well, we don't know, but we know that they're going to treat the inflammation, and how are they going to treat that? You know how. They're going to treat it with all of the immune drugs that are out there, like the biologics, the things that people get when they have the rheumatoid arthritis, all those very expensive drugs that are out there. Now, here's the key. Why does someone develop these, and why are we seeing so much of these? Well, I have a theory, and lots of people who do what we do, who we believe are integrative. And again, I'm not telling anybody not to go to their neurologist, not to go to their immunologist, because you need to get a diagnosis. We would love that to happen. But I've had people who haven't gone, and we've treated it as an autoimmune condition, and their quality of life is better. So, again, I meet patients where there are. But in the theory of the kind of facility that we have, we believe things like, well, are there genetics? That's the other thing I hear a lot of. Oh, it's just my genetics. Well, we believe that, in our theory is genetics load the gun, but environmental issues or epigenetics, how you eat, how you lifestyle, what does it do? It pulls the trigger.
So in this situation, or in a lot of these situations, it's autoimmune, but they are not usually associating with autoimmune.
That's right.
So now that maybe becomes harder to diagnose.
It does. It does become harder to diagnose. And here's the thing. As I said before, what we need to do is look at some of the underlying cause and effect. So how does one do that? Well, I got to tell you, we look at helping the patient with their condition by using some kind of testing. And I'm not talking about all the expensive testing, but, we have to rule out some viral conditions post-virus. Listen, how many autoimmune type conditions did I see post COVID-19?
Many.
Too numerous to count.
Yes.
Too numerous to count. So we really have to look at looking at the antibody levels in the serum. If they have a particular condition that needs a biopsy, like the muscle biopsy, you look for certain things in that. You might look, if it's a gastric problem, you might look at the gastric contents, and they can do this in the laboratory by, doing the endoscope. So again, the clinical things need to be done. And sometimes we actually help the patient go to a physician to get those done as well. All right, if they don't come with that, if they don't come to the practice with the condition already being diagnosed and the laboratories being done. I like to run things like looking at certain interleukins that are involved in inflammation, and that's a pretty specific test, but it's done by the conventional lab. It's done by the big labs that we all know of. So there are ways to look at these autoimmune conditions and see about the vast majority of the cases, see what it takes in the underlying conditions that may be contributing to the cause of the challenge.
Are there any, how can I put this, any unique autoimmune diseases?
Yeah, I'm treating one right now with the muscle condition, right? Think about it, okay? So how are we approaching this? Well, we're approaching this particular patient in a very unique manner. She is going to be starting some of the biologics, and I said, please do whatever they're saying. They're going to be doing something that will ultimately help her immune system shut down, with the hope that by shutting down the immune system, it will come back to homeostasis. And that's something that's done a lot, by IV therapies, by IV therapies in traditional settings. So we told her to go ahead and do this. And what we would want to do is we would want to look at all of her inflammation markers. And actually, I'm waiting for a test, a very specific Lyme type of test. Very expensive. Her sister decided to do it, and I looked at the test, and I actually reviewed the medical literature and the scientific literature. There may be a pattern for this that may be related to post-Lyme disease. But, here's the thing, John. You can take all the immunosuppressants and the new immuno-enhancing drugs, okay? But you do run the risk of having further problems, because when you shut down your immune system, what do you think happens? Sometimes it then goes back into worst overdrive.
So that's really a problem.
Well, it can really be a problem. But again, you may have to do conventional treatments. And I don't say don't. I say let's bring in the conventional, but let's augment those. So One of the things that I'm finding with our autoimmune is more women are affected than men. Why is it? Gender differences in immunity. Women tend to be able, well, women, of course, can get pregnant, and that, of course, they naturally have a stronger inflammatory response than men, okay? So that can play a role. So you go into overdrive. The sex hormones, absolutely. There is a difference. Hormonal issues are affected in these things, and genetic susceptibility. But again, and cell immunity, that's important. Cell immunity, I really look at that. But why is the cell immunity being dysregulated? I do believe there's a huge amount of environmental issues, whether it's how we eat, what we breathe, whether we have some whether we smoke, what are we putting into our bodies that may cause this. So there are many things to think about, but I can tell you, you can improve your quality of life by damping down the inflammation. So what is the common denominator all of these? Inflammation.
And that's how you approach this?
I approach this with the anti-inflammatories, and again, specific anti-inflammatories for specific kinds of conditions. And again, we have to meet the patient where they are. And then you have to build up the immune system. So again, when you talk about, John, and you said, well, what about these weird autoimmune conditions? Well, I want to talk about one. How about an autoimmune atopic gastritis? What do you think that
sounds very complicated.
Yeah, well, it's really not. Okay, all right.
It's something with the stomach, right?
Right. What happens is the body is actually turning against your stomach lining or your stomach cells, right? Okay. So what's one thing that I've been seeing more and more of? H. pylori. You've heard about that.
Yes.
Oh, my God. H. pylori, right? All right. H. pylori. Well, why is that important? Wouldn't you think that's an environmental issue? In other words, you have H. pylori. It goes untreated for many years because you don't know it. You just feel like you have gas and you need to take your Alka-Seltzer. And I'm not plugging Alka-Seltzer, but, or in our case, Borowski. Remember that?
My God. My father lived on that.
Right. So you wonder. So did the chronic infection lead to the disruption in your immune system? I believe it did. I believe it can. So what's the first thing you got to do? You got to look at that and say, did this patient go to the GI doctor, and did he or she be treated for the H. pylori? Interestingly enough, most of my out-of-town patients that come from Indiana all have H. pylori. It is consistent right down the track.
And why is that?
I think it's in their soil. And I think they're eating their vegetables that they make on the farm, the farm animals. I think the acid juices that are released during the digestion over many years, the H. pylori is enjoying that particular place, period. It's in there. It's the bacteria is enjoying its environment. Okay, so therefore, they seem to have the autoimmune attack as opposed to just H. pylori, because they get treated for the H. pylori and they still are not feeling better until they do a course of treatment at our facility.
You know what I noticed about all those people from Indiana?
Yes.
None of them are overweight.
No,
and they're very thin.
They're very thin because they don't eat so much because they have all this gastric attack. So I think about this a lot, and so I look at this, and I say, okay, are they older than 70? No, not always. They're usually young. I treat a lot of young people. Do they eat a high-salt diet? A lot of them do. And they have H. pylori that is still active. We look for that, and I send them to the gastric people around the corner from our place many times, and again, they still have an active infection. So and we of course look at this and we say, okay, what does this lead to? Very interesting. Not only the autoimmune problem, but it can lead to what? Stomach cancer.
Wow.
So we need to treat this in terms of both conventional and in the way that we do with the anti-inflammatories, and in particular for this type of problem.
Okay, we'll stop you right there.
Okay.
We'll pick that up after the
Okay,
break.
sure.
Fascinating discussion. It's Health Watch, Sundays, 8 till 9. That's the live version here on Talk Radio 1210, WPHD. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. You have a question for Dr. Molly or a medical challenge you want to run by her? 855-839-1210 is the number. 855-839-1210. That's the number here, and I'll get you in to talk to Dr. Molly again with that medical challenge or whatever question you have. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. I'm your host, John DeMasi. Dr. Molly and I return with more of today's Health Watch right after these words. We are back here on Health Watch. Again, operators standing by at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. When you call, you want to schedule that appointment with Dr. Molly, and that's where you will really find out how and what and why and all of that stuff, how she can help you. 856-489-0505 is the number. And the website, InnovativeMedicalAssociates.com. Check that out. A lot of good stuff there. InnovativeMedicalAssociates.com is the website. Health Watch is the show, and we're going to go right to the phones and talk to our favorite caller, Frank. We'll make him the mayor of Northeast Philadelphia, all right?
I was going to make him the actual doctor of Northeast
well, either one. Okay. Frank, good morning.
Hi, Frank.
I declined both of them. Joe is the mayor of Germantown, okay?
That's true.
I'm a Huggy Bear from Mayfair.
You're the best, Frank. Go ahead. What's up?
First of all, I'm grateful. A phone call woke me up 15 minutes ago because I would have missed your great program again. That already happened twice before. I don't know why I slept so long. A couple of things, Dr. Molly. Oh, I was one of those people last week that called in the last couple seconds.
Yes. No, yeah.
I got him 47 seconds ago, I think it was, or something.
Yeah,
Dr. Molly, what you're talking about today, I always get mixed up. I asked it before, and I forgot. You talk about genetics in my family. It's in my genes.
Sure.
Genetic mutation, is that the same as it's in my genes, as my genetics?
Yes, you can have a mutation that contributes, and that's a mutation on a certain segment of the genes in your DNA that can contribute to some of the challenges that you're having. Today, of course, I'm talking about what I was talking about is these autoimmunes that are so obscure, Frank, and that people don't even know they have them. And they're being treated for maybe an underlying condition, but not really for the condition itself. But, in many cases, not all, just because you have the genetic propensity doesn't mean you have to suffer from the condition. In other words, you may have the condition, but you can do some things to mitigate some of the side effects of the condition. That's where I'm going with this.
Well,
yes.
That's kind of what I was going to ask you. I mean, my trigger was pulled back in late 90s or 2000.
Yes.
I believe it was due to my lifestyle. At that time, I was boozing all the time. I was eating crappy food.
Yeah, listen.
That aggravated a pre-existing condition, and now I'm trying to correct the pull. Like you said, the trigger's been pulled. It's kind of hard putting the toothpaste back in the toothpaste. I mean,
that's right. That you made a beautiful, beautiful symbol of what this does. So you're right, Frank. And let me tell you, I have a very, very interest in exactly how these happen, and in particular the way it happened to you. I lost my sister about 1.5 years ago from the same exact challenge. She was an alcoholic that went untreated. By the way, she was very intelligent. She was a nurse. Sometimes I believe the stressors of nursing or, helping people in any way, whether you're a police officer, nurse, these kinds of things, all contribute to some of the underlying issues.
I was both of them.
Yes, I know. That's why I mentioned it, of course. And I lost her to this condition, and she was she was a wreck. And I'm going to go into some of her challenges. And here I have the full clinic that could help her, but she didn't want to stop the underlying contributing factor to it, which was, of course, the alcoholism. So bottom line is, and we could have helped her with eliminating the alcoholism as well, just didn't want to do it. So, and again, there's a lot of emotional baggage that goes with some of these things. But you're right. You're absolutely right, and your analogy was excellent, and I hope people listen to you today. I hope they
Dr.
listen
Molly, the doctors I trust and believe in, you,
Yes.
my chiropractor who does this kind of
Sure.
testing, I forget what it's
Sure.
called, he's been telling me all along for the last 5 years, it's inflammation,
That's right.
out of control, attacking my eyes and my legs.
Yes.
But last month, I asked my doctor, they were doing blood work, to check
Yeah.
C-reactive protein and C-reactive. They both were normal.
Don't worry
where's-
about that. No, don't worry about
Where's-
that. There
that
are
confuses me. Where's the inflammation at? It's not showing up in the blood work.
It's not showing up on those two markers. It doesn't mean it wouldn't show up in the blood work. As you said earlier in the program, I run some specific tests that look at certain interleukin patterns that really affects certain organs, this kind of thing. And for example, they are the way I would go. I look at the CD cells of particular CD cells. So again, don't just go by the two inflammation markers, because there are many others, Frank, many others. So please,
And Dr. Molly,
sit on them.
To let you know, 11 o'clock this morning, I'm going to Holly Hill to get the supplements Barbara
Good.
recommended.
Yeah, good. I know Holly Hill. They're wonderful people.
No, Barbara gave me a recommendation of 5 different things before I forget. I'm going up there to get them. So,
Good. Good. Please.
I'm sorry about your sister, Dr. Molly.
Thank
I'm
you,
sure she's
thank
just
you.
like you and great. And John, I'm sorry for last week for calling the last 47 seconds.
Thank you.
Okay,
Thank
no
you.
problem. You redeemed yourself today.
Thank you, Frank. Thank you,
Thanks
sir.
for the
God
call,
bless. God bless.
855-839-1210 is our number here in the studio, 855-839-1210. Picking up on what we were talking
Sure.
about before the break, Dr. Molly.
Sure. Well, I just want to wrap up on this, because a lot of people don't even associate gastric problems with autoimmune, right? Another condition that I'm seeing over and over again lately in particular is POTS. POTS. John, I think I told you before what that stands for.
Yes.
Postural orthostatic tachycardia syndrome, right? Phew, that's a mouthful. So that's
It
why
sure
we say
is.
POTS. And by the way, folks, if you're Italian, don't think pazzo.
Yeah.
Think POTS, okay? Now, people who have this is, this is a really terrible condition. Now, they can look at this. Okay, they can check blood smears to see how healthy the red blood cells are, whether you have some anemias. They can look at antibodies. They can do all kinds of things. But traditionally, you need to go to someone who has a tilt table test, which is a way that providers diagnose POTS, because it can measure your heart rate and blood pressure as you change position. The blood, and of course, urine tests, certain things that mimic POTS we want to rule out. There's an autonomic breathing test that measures your response of blood rate during this. But here's the thing. How do you treat POTS? It's very complex. And I'll tell you.
Yeah, you'll hold that thought. We got a
Okay.
call.
Okay, I'm sorry.
You'll tell us how we treat POTS. We're
Okay.
going to pick that up.
Okay.
Steve in Cinnaminson. Steve, good morning. You're
Steve.
on Health Watch with Dr. Molly.
Morning, good morning. Thanks for taking my call.
No worries.
I was just diagnosed, and I really been arthritis in my shoulder. They say I need an operation.
Yeah.
So anyway, I'm going to cure it. I'm 80 years old. I really don't. I'm very apprehensive about doing that. But I hear a lot of talk about this stem cell.
Yeah,
that they inject in
regenerative
Do
medicine.
that? Yeah, are you
the
into
short
that? Or you...
the short answer is yes, but we need to talk in the office about that. Okay, come in for the free consultation. Okay, you and I both know that. I know that there are companies out there charging phenomenal amounts of money for this. But what you want to do is look at peptides in addition to just pure stem cells. You might want to do this with your own stem cells. There are so many ways to do this. So I would love to educate you on that. And if you came in, I think you're a smart guy looking at other ways to do this. By the way, I think, John, you were there when we did the shoulder the other day.
Yes.
Yes, and we did that with PRP, actually, which is platelet-rich plasma. That has stem cells in there as well as the platelet growth factors. So, and also we follow that up with a nutritional IV that actually becomes, if you think of stem cells as planting, like in the ground when you're looking at your flowers, you put the seeds in, but you need the water and give them some nutrition. We believe the same way. Call the office. I'll happily see you. You're a good guy. God bless.
You want my blood work? Do I bring my blood work in and everything?
I'm sorry.
We didn't catch that. Can you repeat that, Steve? Oh, he's gone. Okay.
I don't know what he said, but whatever. If he calls the office and makes an appointment, I think that's the way to approach regenerative medicine. You need to really meet the patient where they are. Okay.
Yes. Can I say you've done a few of these?
You can say yes.
Okay.
We have a real.
You've done a few.
We've done yes. You can say whatever you want.
That's right.
Okay. All right. God bless you, John. Anyway, so POTS. So POTS is a very tough condition, and it affects so many of your organs. In fact, nutrition plays an important aspect in managing POTS because you can have low blood volume. So what do you need? You need hydration. You may have to increase the sodium in your diet, okay, in order to make sure that the nutrition is doing its job. And when we say nutrition, we're looking at 2.5 liters a day of water. Most people don't do that. You have to eat your meals a little differently, right? Because you've got to use complex carbs, or we have to deliver complex carbs through our hydration protocol to lessen the spikes of up and down from POTS. POTS is a crazy condition. People treat it with prednisone. They treat it with certain types of drugs that increase salt retention and blood volume. They treat it with beta blockers to slow down and reduce the tachycardia. But again, I know that there are others. We treat it with a subclinical dose of repurposed medication along with the hydration. So that's one of the things. And exercise is very important.
Does it affect blood pressure?
Well, you bet. That's why it is. It affects blood pressure and blood volume. So yes, you got to go on some kind of program, but you must be very careful. And I'd expect you to come in and we can talk to you about how to treat it.
And with that, we'll take our final break of the morning, which means that you still have some time to call in with a question or a medical challenge for Dr. Molly. 855-839-1210 is the number. 855-839-1210. It's Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi. We're coming back with more of today's edition of Health Watch right after these words. We are back here on Health Watch, and again, operators standing by, and they will be there well after we leave you at 9 o'clock this morning, so if you call after 9, it's okay. They'll be there, 856-489-0505. Again, that number, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show, or if you just want to hear it again, feel free to listen this afternoon, 4 o'clock. It's our Health Watch replay, 4 till 5 this afternoon, here on Talk Radio 1210 WPH.D. We got a few minutes left of the show, and that means you have time to call in, 855-839-1210. Got some interesting patients this week. One with ringing in the ears.
Yeah, I believe it's autoimmune, and that can be related actually to my earlier segment about autoimmune gastritis and gastric response, believe it or not. And I'm really trying to work with this gentleman because I really believe he's having an autoimmune response. There's one large system in the country, well, actually there's two, one on the East Coast and one on the West Coast, that actually works with patients like that, and I'm trying to get him to see one of the renowned experts there, but unfortunately his doctor here in New Jersey put him on a anti-anxiety med that is highly addictive. So we have to bring him off of that med in order to get him there, because he won't fit the profile on that, because one of the side effects of that med is ringing in the ears. So this has been an interesting case. He's been doing exceedingly well, cutting down on the drug, utilizing our protocol to help him. So that's one patient.
There's another one, weight loss.
Yeah, oh, she's doing great. She's using our peptide and our nutritional program IV. In 10 days, she's lost 11 pounds, and she's been unsuccessful in other diets. Plus, we're keeping her very safe. I want people to understand that the use of natural occurring peptides, by that I mean ones that are used exactly like in the body, not just the drugs that are out there that are doing this, repurposed drugs, but actually having the compounding pharmacist, who we adore, our pharmacists, so they can make this up, and we utilize that in our treatment protocol. It's a peptide, and we use the nutritional process. I also want to send a shout out to my schoolmate, John.
Oh, yes.
Who started
yes.
with me, Pauline. She started with me. Now, I'm not going to give away her age because she looks so much better than I, but we were schoolmates at South Philly High. So this is an interesting case because she has hyperlipidemia. In particular, her blood work looked phenomenally well. She and her daughter have done extensive research in nutrition, so she's been following a good diet, whatever. This week, I am going to send out for the Cleveland Clinic heart test. That is a traditional test now, thank goodness. Then we send it out through one of the traditional things. It's about an 8-page test that comes back that may give me a little insight into the reason why she has the hyper triglycerides, and then I'll be able to really more customize her particular treatment protocol. But I wouldn't be surprised if in her case we don't have an environmental issue that might be contributing to hyperlipidemia in her case, or vascular inflammation.
You know, I want to talk about, just for a moment, you were mentioning genetics earlier in the show.
Sure.
If you have nothing in your history,
yes.
And in my case, my parents didn't have cancer.
I know.
I mean, there was nothing.
I know.
So,
again,
what is it?
Well, you know what, John? I'm going to tell you. Environmental issues can cause this. You might have been exposed to mold. You might have been exposed to toxic fumes when you were younger. Listen, you worked in a toxic environment. You were in radio your whole life, you know?
Yeah, that's
so,
toxic in itself.
Come on. No, stress, John. You have a lot of stress. Secondhand smoke. I mean, you had to go out on calls. I'm sure you were in a place where there was a lot of secondhand smoke, right?
Yes.
You rep many different types of businesses. So you and I both know that those things contribute, and maybe contribute more. There, again, I go back to what I said. Genetics load the gun, but it can be these external forces that pull the trigger, and then the body goes into an overdrive. We look at cancer as a autoimmune disorder, and interestingly enough, you have another autoimmune disorder. If you consider diabetes as an autoimmune, no one ate better than you.
That's right.
My whole time. Okay?
That's right.
You always watched your carbs because you were never overweight. I have a patient who's coming in this week. He's a mess. I mean, he is a mess. Does he have the genetic propensity for diabetes or myocarditis? I don't know. But I'm leaning towards him having an autoimmune cardiac problem along with some other things, and he's grossly overweight. So what do we do? Is it what we eat? Is it where we live? Is it all of these things? I think it is.
Is there such a thing, and can you achieve this, and can you achieve it, or however you get to it, is there such a thing as cell immunity?
Yes, of course. Our cells are always working to protect us. It's when they go haywire and start attacking our own bodies. That's when we have all of these autoimmune conditions, whether they're the ones that we're used to seeing or some obscure ones. So yes, what triggers it? Therein lies the rub. But can we improve your quality of life, even if we never find out what triggers it? We can. We can by the use of nutritional products in a way that are a therapeutic level, and I believe medical hydration is the vehicle by which that can happen.
So you're saying the body can turn against its own stomach?
Yes, but it's not like it's a full force against your body's at problem. No, something caused the body to mistakenly put it in overdrive. My job is to get it back if we can and figure it out. Look, all of these autoimmune conditions cause what? Nutritional deficiencies. For example, the gastric one causes vitamin B deficiency, B12, so you can have an anemia. So you need to look at the total person. You can't say, oh, his body's just going against him. No, I don't want to believe that. I believe we can achieve quality of life by really looking at this, using the anti-inflammatories, using the things that can boost your own immune system, and thereby help you move forward with quality of life, whatever that looks like for you. I'm not saying we're curing the disease, and I will never tell you get rid of your traditional meds, but I will tell you some of the meds they use in autoimmune diseases cause a whole lot of havoc on the body.
And I've noticed some of your patients, and you do this as well, get vitamin B shots.
Oh, yes, B shots and also D. D is very important to immunity. So there are many, many things. In addition, by the way, we don't just give the shot. We actually use certain extracts of Bs in the bags. So again, John, it's going to be specific for what's going on for a specific patient. But as I said before, it is very important that we assess where the patient is now and what is it that we're looking to accomplish, because your happiness or your functionality for what you want to do is different than mine. But overall, it's our quality of life, no matter what that is. That is what makes living with whatever we have, living with our conditions, but putting them in a place where we can live through it and happily.
And every bag is different?
You better believe it. Every bag is different for the most. I mean, somebody has like and kind conditions, we might use some similar products. But again, we're not going to say that my bag is the same as yours. It doesn't work like that.
Real quick, we got about a minute. We're going to talk to Tom in Pennsburg. Okay. Tom, good morning.
Hi,
Welcome
Tom.
to Health Watch.
Thanks for call and letting me in. Just want to ask, Midwest seems to be deficit in iodine. Would that have anything to do with H. pylori?
Yes, I think you've called me before, and I think I said yes, and it also can contribute to all kinds of thyroid, which also there are many thyroid conditions that are autoimmune. So you're absolutely correct. But again, I would caution people to use iodine carefully. So you just don't go out and buy it and, start using it. You need somebody to help you manage how you use your iodine, because you don't want to put yourself into overdrive in other ways. So I agree with you, okay? But again, I want you to get some professional help with that.
Tom,
God bless.
Thanks a lot for the call. And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, 856-489-0505, 856-489-0505 is the number. Check out the website as well. You'll get a lot of information there, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show, if you want to hear it again, sure, 4 to 5 this afternoon right here on Talk Radio 1210 WPHT. It's our Health Watch replay. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel, and then, of course, there's Joanne, fabulous Fran, delightful Dee, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, Health Watch 8 till 9 here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.